Hello, everyone, and welcome to the Med Security 2022-2023 Employee Benefits webinar and presentation. Excuse me. My name is Ben Hallback. I share responsibility with a woman named Sachi Lucas to make sure that what ends up in this guide is the best possible benefit at the best possible price. So we're going to go through a couple of different, oh, wow, that is going to make you really dizzy. I got a little quick on the draw there. Here we go. Benefit offerings, medical, dental, and vision. We're going to cover those three things today. Your medical pricing, get from HR. Dental and vision will be in this book. Okay, so right before we start, a couple of administrative housekeeping type items. What you choose during open enrollment can't be changed outside of open enrollment unless you have one of these IRS approved qualifying life events: marriage, divorce, birth of a baby. If your spouse is in their open enrollment period, that is a qualifying event. And so in general, what you pick sticks until next open enrollment unless you have a IRS approved reason where you can change. That hadn't changed. That's not new. That's always been the way that it has been. We stayed with Humana. We have the POS Open Access Network. So when you access care, make sure and ask the best question, which is, a good question is, do you take Humana? The best question is, do you take Humana? I am in the National POS Open Access Network. So make sure you validate the network. Big insurance companies have lots of different networks, so you just want to make sure that that provider is in network. The plan year starts over October 1st, but your benefits always run January to December. So that the October 1st is when the new plan starts administratively. It's when if the carrier gives us new rates, that's when those take effect. It also governs when open enrollment is and for eligibility for Affordable Care Act reasons, all sorts of that good stuff. So October 1st is when these benefits are in effect. They're the same as they were last year, but January to December is when your actual benefits run. So you've got two different health plans. You've got an HSA plan that is a lot like the one that I have, and then you've got a copay plan that has copays for doctors and prescription drugs. So if you were looking at an HSA, you would want an HSA because it would be potentially less expensive than a copay plan, and it would also give you an ability to go to your bank, set up a HSA bank account, and you can put money into that account actually pre-tax. That's what I do. Put as much money as I can stomach into my HSA account. I don't pay tax on that income, and I can use it if I have an expense, or I can save it for future expenses. That's how I do it. But HSAs do have some drawbacks. For that ability to pre-tax money into an account that you can keep, when you go to the doctor or a prescription, those are the two biggest areas, doctor and prescription on an HSA. You pay the discounted rate for staying in network, but you do not pay a flat rate copay. So just look by comparison. The Buy It plan has $30 and $45 copay for office visits, primary care and specialist. And then you've got prescriptions on different tiers of coverage depending on how expensive the drug is. So you've got copays for that, copays for that. The HSA would work like this. If the doctor visit was $200 and the Humana discount was 50%, then you've got $100 for seeing that doctor. That would apply, and everything tracks towards your out-of-pocket max. So any covered in-network service goes toward your out-of-pocket max. When you're in a hospital, that's when your deductible is going to be asked of you. You pay the first $4,000, the hospital pays the remainder. They pay after you hit 4,000. So at 4,000 and that next dollar, 4,001, you're paying 20 cents of that $1. Humana's paying 80% or 80 cents of that $1. And those 20 cents that you pay after your deductible, they add up, add up, add up. Once those 20 cents equals $2,350, how did I get that number? If you've got $1 million bill, you pay the first 4,000. After that, you're paying 20 cents on the dollar. And that 20 cents on the dollar has to equal 2350 because 6350 less 4,000 of your deductible equals 2350. So therefore, Once you pay that 20 cents on the dollar and you fill that bucket up, the dollar amount of that is $2,350. Because if for an individual covered on this plan, January to December, most financial liability for covered in network services is $6,350. That's how that works. The copay plan or the buy-up plan does have copays for office visit, retail, and virtual. It does have copays for prescription drugs. It has a lower deductible, so it's $2,500, and then coinsurance, you're paying 30 cents on the dollar. So once your 30 cents fills up bucket number 2, so to speak, bucket number 1 is the deductible. Bucket number 2 is coinsurance. Bucket number 3 is the out-of-pocket max. 1 plus 2 equals 3. So 2,500 plus this 30% has to equal 2,500 because the max is 5,000. Once you hit 5,000 for covered in network services, there's no more risk. There's out-of-network benefits as well, but they're always greater. There is family coverage as well. Obviously, all that's on here. I just use the individual for purposes of the presentation, but you double the amount for family. Oh, I did it again, guys. I am not doing good on driving here. There we go. Okay, this page is important. We already talked about cost. Call HR. They will be able to give you your cost for that. But the reason why I am on this page is for prescriptions. If you have a prescription and you have a name brand and a generic, and you want the name brand, the doctor needs to write dispenses written for you to get the name brand drug. Otherwise, you will be steered towards a generic. This is a great public service announcement here. Unless it is life or limb threatening, don't go to the ER. If it is life or limb threatening, go straight there. There are emergency rooms inside of a hospital and outside of a hospital. That's what a freestanding emergency room is, and it can get confusing because those freestanding ERs sometimes look like urgent care providers. They are not. They are a freestanding ER, so just be aware of where those are. This is some information when you log into Humana. They've got a website, they've got an app. It's easy to find in-network doctors, see where you are in your schedule of benefits. This is 24/7, 365 doctor on demand. First time I used this, my third kid had pink eye. I didn't want to go to the doctor. I was there, held the kid up. Look, doc, she says, you're right, Ben. Sent some amoxicillin to the closest pharmacy. Pretty easy. Go365 is the most integrated wellness offering in the insurance market that is integrated, that is there. Go365, you can track your steps, you can do some biometric screenings, you can get some labs done, and they all accrue to different points inside Go365. You can convert those points to actually pay for things at Amazon, Target, Spa Finder, Fitbit, Lowe's. Goodness, if you can't find anything from Amazon and Target, that's most of the expenses out of my own bank account. It's really easy to participate in this program. What you do is you'll go and you'll register and sign in, go365.com, click activities, take an online health assessment. They'll give you your Go365 age, which may or may not be surprising. And then there's all sorts of different ways to earn points. You can count your steps on a Fitbit or a watch, or you can just count them on your phone. And then you can get biometric screenings. You can do your preventative services, flu shots. There's all sorts of ways to get Go365 bucks. And then you take those bucks to the Humana online portal and you can fulfill your dreams at one of these retailers. So there are different levels that you get to: blue, bronze, silver, gold, platinum. The more active and the more you participate, the higher the metallic tier you will earn, which also translates to more bucks and more stuff from one of those retailers. This is a slide that details different activities that you can do from an education, prevention, healthy living, fitness. We were on Go365 for years, and shoot, if I could do it, anybody can. These are activity-based points, just more ways to get points. I will say a lot of that, if you have not done that, can be a bit overwhelming. It is not complicated, but if you just hadn't done it before, you might need some direction. So call our office. We have 3 folks in wellness. They either have Michelle in their first name or middle name. It's a thing. So please call us. I have asked more dumb questions of one of the Michelles because I couldn't get my stuff to sync right. And they're patient and they handle those questions with dignity. How about that? Dental and vision, and then we'll be done, guys. Kept it with Humana. It's the dental preferred network. So here's how this sucker works. You pay these premiums, they come out semi-monthly, and then you go to the dentist. And it is free. Your twice a year teeth cleanings, x-rays associated with that do not have any cost to you because they're already coming out here, right? So let's say you have a cavity and the cavity is $200. Well, you're going to pay your individual deductible of $50. 200 minus 50 is 150. A basic service is 20%. So 150 of a bill, you pay 20% of that, you pay $30. 80% of 150 is 130, and that 130 that was just paid by Humana reduces this $1,000 annual max. So $1,000 a year Humana throws per mouth per year. You do get ortho one time for $1,000. But I have 2 people in my house in braces right now. They do cost more than $1,000. So something is better than nothing. You do need to be on the plan 12 months in order to receive that ortho benefit. I did it again. That's confusing, y'all. Sorry. Trying to find a better way to scroll here. Vision. Stayed with Humana. It's the iMed Insight Network. So when you go to seek care at one of these places, LensCrafters, Pearl Vision, Today's Vision, then you'll say, I have Humana iMed Insight Network. You go in for a $10 copay, and then you've got a choice. You can do $130 stipend for your glasses, and then you get 20% off over that. And then the lenses that go inside those glasses are on a copay unless you're super blind like me, probably not getting out for a copay. So you can either go that route to have insurance pay for, or you get contact lenses, $130. So you can't get both at the same time covered by Humana. It's either or once every 12 months. Costs are there at the bottom. I've learned my lesson. I'm scrolling differently now. This is an EAP. Humana beefed up or made better their employee assistance program. And the past few years have been stressful due to COVID. So we're getting a lot more requests. Insurance carriers are getting a lot more requests for help. And so I'm going to go to this page. LifeWorks is free to you. It's paid for by the company. It's through Humana, but LifeWorks is the vendor Humana is using. So I want you to look at these different areas down here. Go to LifeWorks website. You've got your username and password and see how they can be beneficial to you. There's all different kinds of stuff, marriage, family, financial, all different resources that they bring to the table. Go back to this page just to comment on the bottom of page 14. Premium only plan simply means when you are purchasing medical, dental, or vision, that is not taxed. So it's your portion is that's from your paycheck is not subject to tax. That's what that means. Great late night reading material is the rest of this presentation. The final page lists out different customer service units within Humana for different things, our contact information, and of course, you can always call Lindsay with any questions. And that concludes the presentation. Thank you very much for paying attention and hanging on. Have a great day.